Here's what we'll cover in this video. Your heart is racing, your chest feels tight, and a wave of fear hits you out of nowhere. There's no tiger, no danger, nothing actually threatening you. Yet your brain is absolutely convinced you're dying. A panic attack isn't a sign of weakness, and it's not just stress in a dismissive sense. It's your brain's alarm system firing at full force, even when there's no actual threat around you at all. This is far more common than people think. Studies suggest up to 11% of people experience at least one panic attack in a given year, and many never tell anyone it happened. The trigger sits deep inside your brain, in a small almond-shaped structure called the amygdala. It's constantly scanning for danger, and sometimes it misfires, sounding the alarm when nothing is actually wrong. Once that alarm fires, physical symptoms hit fast. Racing heart, shortness of breath, dizziness, sweating, and a tight chest are some of the most common, often peaking within just 10 minutes. Panic attacks tend to peak fast and fade fast too. Most reach their worst intensity within about 10 minutes, and the majority resolve completely within 20 to 30 minutes, even without treatment. Here's the chain reaction. The amygdala sends a distress signal, your body releases stress hormones, your heart rate spikes, and your breathing quickens, all within seconds, exactly like a real emergency. This is your body's ancient fight or flight system, built to help early humans survive real physical danger. The problem is, it can't tell the difference between a genuine threat and a stressful email. During an attack, your heart rate can jump for a resting 70 beats a minute to well over 120, while your breathing becomes fast and shallow, part of why people feel like they can't catch their breath. Behind the scenes, your adrenal glands flood your bloodstream with adrenaline and cortisol. These hormones are what cause the shaking, sweating, and that intense, jittery feeling people describe during an attack. If you checked someone's vital signs mid-panic attack, you'd see a fast heart rate, quick, shallow breathing, and sometimes slightly elevated blood pressure, even though nothing physically dangerous is happening at all. Interestingly, the physical symptoms of a panic attack overlap heavily with a heart attack, which is part of why so many people rush to the emergency room, understandably fearing the worst. A few more numbers worth knowing. Around 2 to 3% of people develop full panic disorder at some point in life, and it tends to appear more often in women than in men. Quick pause. If this breakdown is helping you, take a second to hit like and subscribe. It genuinely takes a lot of effort to make videos like this, and your support keeps them coming. Treatment works remarkably well. With therapy alone, most people see major improvement within 12 weeks, and combining therapy with medication often speeds up recovery even further. Consider a 29-year-old who felt sudden chest tightness and a racing heart during a work meeting, convinced it was a heart attack. After ruling out heart problems, doctors diagnosed a panic attack, and breathing techniques plus therapy resolved future episodes. Some people are more prone to panic attacks than others. High stress levels, a family history of anxiety, major life changes, and excess caffeine can all raise the odds, while some tendency is simply inherited. Compare someone who learns coping techniques versus someone who doesn't. People who practice breathing and grounding techniques report significantly shorter and less intense attacks compared to those who don't. Look at the difference therapy can make. Someone who completes a course of cognitive behavioral therapy often goes from multiple panic attacks a week to nearly none within just a few months. So what actually helps in a moment? Slow your breathing on purpose. Name 5 things you can see around you. Remind yourself the feeling will pass, and avoid fighting the sensations directly. Longer term, regular exercise, cutting back on caffeine, consistent sleep, and learning relaxation techniques all lower how often panic attacks happen in the first place. Here's a myth worth busting. Many people believe panic attacks are dangerous or can cause a heart attack. In reality, they're not physically harmful, even though they feel absolutely terrifying in the moment. Quick check before you go. Which brain structure is primarily responsible for triggering a panic attack? Think it through, then see the answer. A panic attack is your brain's ancient alarm system misfiring, not a sign that something is fundamentally broken about you. Understanding that difference is often the first step toward feeling less afraid of it. Almost every panic attack, no matter how terrifying, ends within 30 minutes or less. Your brain isn't broken, it's just sounding an alarm that doesn't match the moment. Here are the key references and sources for this video. Thanks so much for watching. If this helped, like the video and subscribe for more clear, simple explainers, and I'll see you in the next one.